Well, it's a pleasure to be here. It's an honor for me to continue the great work that Bob did with this project, and the way we all have a piece of Bob on us, right? And the way that we find to honor him was taking care of the project that he liked the most, that he used to refer to. So thank you, Paul, for the opportunity. I want to start by mentioning who are the ones that are following Bob's legacy and Bob's leadership on this project. And there is really a number of people that are involved on this project. I want to mention particularly two individuals here. Cesar Corso, who's going to talk tomorrow, and one of the main sessions. He's the new Leman chair and will be co-PI for this project moving forward, and will be helping to take this legacy. And Dr. Kim VanderWaal, who will be sharing the presentation with me, and who is now an assistant professor in our group, and will be in charge of the analytical aspects of the project. And of course, the people that do the day-to-day work, number of individuals that do a great job keeping it up and maintaining and sustaining the project daily. So, for those of you that are not familiar, what's the SHMP? Well, Bob started the SHMP as an initiative to share data to address in part some of the knowledge gaps that were identified in the epidemiology of PRRS. And the way Bob explained to me when I first moved to Minnesota back in 2014 was that we were trying to do two things. First thing, in the long term, we want to try to develop capacity to give the industry the opportunity to voluntarily respond to an emerging pathogen. Second, in the short term, we want to deliver value to producers and their veterinarians such that they participate for the long-term objective. And that goes along the lines of the presentation that Dr. Dufresne did today in terms of the vision of Bob moving forward and the work for the common good. So being a non-reportable disease, having people to agree to share their data and to work for the common good was a big challenge, and a manifestation of that intention, strong intention that Bob had towards that end is this project. So he started with some meetings in 2011 in this conference and at ASB, just trying to convince people of working together and sharing their data for the common good. So starting in 2011, he collected data retrospectively on PRRS for 2009-2010, and then 2011 prospectively on a weekly basis, collecting data of PRRS incidence and PRRS status, and we have been doing that since then. So what's the project today? Well, the project is, I would argue that this is one of the largest voluntarily shared databases in the world applied to food animals. We have 33 systems with this distribution of companies. It includes about 50% of the U.S. South population. It's amazing. We collect data on locations, incidents, and for some of the incidents of PRRS, now PED, and we are starting gradually to collect information on other diseases. And then for some particular systems, we also have movement data, so we can help them to make an interpretation of the results. 25 companies and 4 regional projects share their logo and are willing to share their premise ID. And this is the report that we produce weekly. There are two types of reports. There is one public report that will be accessible to everyone. And then there is a private report for each system, for each company, that includes information on their own company. So you have heard a number of times, and for those of you that knew Bob, he was pushing us all the time to see, every time we have a new project, we get a new knowledge, we want to do something new. He used to tell us, well, that sounds great, but what's going to be the impact of that? How's that going to be useful? He pushed us a lot on that. So here's a summary of 5 things that this project helped us to learn. 5 things that we learned, and this project helped us to learn that maybe wouldn't be that obvious without this project. The first thing that we learned was try to estimate the temporal patterns at the national level for PRRS. And here are a couple of examples. This graph here is a report that we produce weekly that helped us to see the repeated pattern that PRRS had in the country at the national level. So one of the most interesting things was that this was a threshold that Bob set up to identify, based on the previous number of outbreaks, when the epidemic season started in the country. And one of the interesting things we first saw was that pretty much the same week every year we had the epidemic season for PRRS starting in the country. That was something that was possible because of this coordinated action and this share of information. In relation to that, when PED broke, what we saw was the influence that another disease may have on that pattern. And this red line here is the cumulative number of PRRS outbreaks the year that PED broke. And you can see that how the PED epidemic impacted on that pattern, and there were a number of hypotheses why that did happen. But this project helped us to see that and to monitor that. Second thing we learned more recently was that actually what we believed was the common PRRS pattern in the country actually didn't happen consistently across the country. So if you can take a look at these slides here, it's showing that disaggregated pattern of outbreaks. The yellow line here will indicate the incidence, the number of PRRS outbreaks in different regions. And these two are the Midwest, the South region, and this is the Southeast. And you can see that although we saw that repeated pattern on an annual basis in the US as a whole, then truly the patterns are different, particularly if you compare the Southeast and the South with the Midwest. And that national pattern that we were seeing before is pretty much dominated by the pattern that we see in the Midwest. When you go to the farms and the systems in the Southeast, actually what we see is that there are peaks every 5 years, every 4 or 5 years, and then between those peaks, the number of outbreaks go down slowly until we enter into a new cycle of an emerging strain that will cause, again, an increase in the number of outbreaks. So two completely different patterns. One thing in which we are working now is the red line here. It's actually not measuring the incidence, it's not measuring the number of outbreaks, but it's measuring the transmission rate. So we think that with that information, we can anticipate when we are going to see these peaks. Because if you can see here, particularly in the Southeast, there is an increase in the transmission rate 2 periods of time before we actually see the epidemic. We see the outbreaks. So, and that makes sense. I mean, the disease has to start transmitting rapidly so it can reach the epidemic proportions, right? So by keeping track of these numbers, we think that we may be able to anticipate 1 to 2 weeks in advance when the epidemic is going to happen. Another thing that we learned working with this project is economic, or we helped to learn or get better estimates of the impact of disease on production. And there were a number of studies out there, some of those conducted by ourselves in Minnesota, some of them in collaboration with Iowa State. Dr. Linares and Holcomb are leading that project. And Daniel presented this slide at the workshop on Saturday, where basically he showed the impact that reduction in the number of, or the increase in the number of farms that reach stable status through vaccination may have had on the impact of the disease in the country. So that's another interesting application and learning feature that we got from this project. Another thing we learned with this project in which we are working now, is the influence of disease or the influence of epidemiological features on disease. And this slide here is illustrating the interrelation between different factors and occurrence of PRRS. And we are showing here, and this is work in progress, we have published some preliminary results, still working on that. But even after you accounted for factors that we know that influence PRRS incidence, farm size, swine density, system, region, there are still other factors that may influence the risk for PRRS, and one of the most interesting that we are seeing now are land slope and land coverage. So we have a couple of projects moving forward trying to estimate the influence of trees and land coverage and land slope on that risk of PRRS transmission. And finally, another interesting thing that we learned with this project is how we could use sequencing to inform decisions and to predict the spread of the disease. And the slides here are showing a phylogenetic evolutionary analysis that shows how the virus mutates, the virus changes, and then we can use that information to keep track on how it's spreading between systems. So this graph here, the systems have been coding for confidentiality reasons, but basically shows for an emerging strain of PRRS that initially the virus was sitting in sow farms in this system that here has been coded with green, and then eventually, but it was there for quite some time, and eventually it hit this other system that is marked here in purple, and then when it got into that system, then it spread to all these other systems that were modeled here. So we can use that information to trace back and for how a virus is spreading and how it's moving in a given region. And then the other application that this phylogenetic analysis has is that with emerging strains, we can forecast if the strain is going to, this showing the viral change and the viral load as a function of the mutation of the virus. So it's showing how the virus changed in time, and we can use that information to forecast if a strain like this one is going to stay in the population, it's going to be maintained there, whereas other strains may go down and actually die off in the population. So that's another application of this project. So moving forward, we are trying to condense and combine this information and see how we can use this in terms of prediction and control. I'm going to turn it on to Dr. VanderWaal here to make that presentation. It's really her baby. So.
All right, thanks. So I'm really excited to be able to show a little bit of what we've been working on for the last year, which is more of a pilot project or a proof of concept that we can start to make predictions. And I'll talk a little bit about what we've done and also what we want to do in phase 2 of this project. So the basic idea here is that as part of a lot of the work that Andres just summarized, we are having like an increasing understanding of all of these factors that are driving how these swine pathogens are circulating on the landscape. And the idea is that we can start taking all of this information and all this data we have and stop having it just be data that's just noisy and start making predictions from this data and actually creating information that can in advance forecast when we think that farms are going to break. And I just want to briefly recognize Dr. Gustavo Machado, who's the postdoc that's in our research group that's responsible for a lot of the analysis that I'm going to show. So the goal of this work is to quantify and dynamically predict the risk of PED outbreaks in sow farms. And we're using the MSHMP database for this as well as a lot of other data sources. But the idea is that we want to start being able to say, okay, can we predict what's going to happen next? So we use what we're calling neighborhood effects on risks, where we have a sow farm, which is represented by this blue triangle, and we draw a buffer of 10 kilometers around that farm. We define that as the sow farm's neighborhood. So within that neighborhood, we have a lot of information about where the other neighboring farms are, as well as if they're sow farms that participate in MSHMP, we know if they're infected or not. We also have things like animal movement data. So are your neighbors moving in pigs, or have they moved in pigs in the recent weeks? Because of course, if they're moving in a lot of pigs, then that increases the likelihood of a local exposure to, or a local introduction of the virus that then could get into the sow farm. And then the likelihood that any of these kind of local area spread the likelihood that would occur would be affected by a number of microenvironmental factors, including things like weather, land use. We alluded to vegetation and tree cover. So all of these things are going to then affect the likelihood that that farm would get exposed from its neighbors. So we put all of these factors into a machine learning model. I just want to briefly show you what this looks like. This is 1 year, like kind of a weekly time lapse of 1 year in the systems that we piloted. This is 3 systems. And you can see that each of these circles represents one of these neighborhoods around a sow farm, and they're going in and out of whether or not they're infected with PED. So this is what we're actually trying to predict. And we use a machine learning model to actually try to predict this. I'm not going to go too much into the details of how we do this. But essentially we get a number of variables that are important for predicting spread. So the ones at the top of the list are more important in predicting whether or not sow farmers break with PED, and then we go to less important. And I can't break it down completely here in the time I have, but what I wanted to highlight is that the accuracy of our model right now is around 83%. So we're pretty happy with that 83% of the time, or over 80% of the time, our model's correctly predicting what's going to happen in these sow farms in terms of whether they're going to break or whether they're not going to break. So we're pretty excited about the potential of this method to actually start forecasting ahead of time, say in the next few weeks, of whether or not a sow farm is going to break. This is just another look of the data. You can see we just have we can look at the spatial heterogeneity and who's going to break. So we have, even in dense regions, different sow farm neighborhoods are experiencing different risk in week 4 versus week 14, so we can start capturing that. And looking ahead, we really want to put together this forecasting model and to move away from just doing a retrospective analysis of what's determining risk, but actually apply that in a prospective way and provide this information back to our participants. That includes a biweekly farm level forecast, as well as risk maps highlighting areas where new breaks are likely given the prevailing conditions. And then importantly, we want to expand out to more regions than where we piloted this project, as well as expand this approach to PRRS. And for both Andres and I, we want to recognize all of the MSHMP participants that made this work possible, as well as our funders and a lot of other collaborators and partners that really made this work possible.